Oh yeah, this is the interview in this week after question time last night. There's a lot of fuss about question time last night because of the makeup of the panel. And a week after, there was quite a lot of accusations of the BBC of having a bit of a bias towards the government. And Question Time decided to put a panel on made up mostly of Murdoch stooges and Conservative ministers. And then obviously you've got Jess Phillips on this week, who's a bit of a controversial figure because she says a lot of stuff that doesn't really make sense. So it was pretty disparaging actually. But in the midst of all this, we have the most brilliant dismantling of the junior doctors' strike by Tamal Ray, which has been overshadowed somewhat by the woman on Question Time, who got very emotional and sort of really dispelled a few myths. Tamal Ray did it in a slightly different way. He calmly dismantled the government's position, which was put forward quite eloquently by Uncle Portillo. So, hope you enjoy. Okay, so we're about to see why I like Michael Portillo so much.
The government is right, the doctors are completely wrong. You are substantially more likely to die if you're admitted to hospital.
No messing around there, he tells us exactly what he thinks.
An emergency over a weekend, and that is an intolerable situation.
So the first reason there is what's often trotted out is that you're substantially more likely to die at the weekend.
In the 21st century. And the doctors ought to be as keen as the government are on putting that right. In fact, doctors ought to be more keen because doctors supposedly have taken a Hippocratic oath and supposedly their biggest concern in the world is the security of patients.
And now he's just going on the offensive, saying that everyone should support us in those homes.
They have to pay their rent.
Most of the issues in the negotiations have been settled.
So, okay, he's developing here saying that the actual issues that are coming up in the contracts have been sorted out, so there's no reason why the doctor shouldn't sign it.
It isn't the government that's not at the negotiating table, it is the junior doctors who are not at the negotiating table. The starting position of the government is an 11% rise in the basic pay of doctors.
And now he's going to stress out all the positive things about the contract, which we hear on a regular basis.
And indeed that doctors should be available 7 days a week. There's nothing puzzling about this. It does not mean you work every Saturday of the year. There are lots of people who work 7 days a week. I mean, for instance, airline pilots are a good example.
So now he's associating doctors with a similar role as airline pilots. And we'll find
it doesn't
out why
mean every airline pilot works every Saturday or every Sunday. It means that there are sensible arrangements to make sure that a plane is as likely to be flown safely on a Sunday or a Saturday as it is on a Monday to a Friday.
So, yeah, he's associating it with safety and the fact that they are essentially middle-class professionals.
What's your reply?
I mean, the current contract that we have at the moment provides for us to be providing emergency care over the weekend, which is what your analogy to an airline pilot was to. I think what we're talking about is expanding healthcare into elective services over the weekend,
yes,
which I think is a fantastic aim, and we would embrace that, and the profession has already stated that we'd embrace that. If you want to provide that huge expansion of services, though, you need to have personnel and you need to have the resources to do it. It's not doctors that we work in isolation. We need nurses, physios, all sorts of
all the
people.
Backup.
Yeah, and we also need we also need social care that we can discharge all these patients to on the weekend. You could have 20 doctors to every patient in the hospital.
But I go back to Andrew's question. How has your striking helped to achieve any of this?
So effectively there, Tamal Ray has just dismantled Michael Portillo's argument, and now he's going on to a completely different subject, switching around. We're talking about, well, what is the strike supposed to achieve? So implicitly he's accepted the justification there. But now he's going on to purely practical concerns. What do you expect to achieve from this strike?
The negotiations were continuing. Most of the points have been settled. By the way, it's all very well you saying this is about expanding into elective care. The fact of the matter is that we have 1,000 excess deaths at weekends.
Okay, this is the great fact that's trotted out by Jeremy Hunt and Conservative ministers practically every day at the moment.
What are you basing that on?
Elective care wouldn't change that.
No, exactly.
Elective care is like routine knee operations. That's not going to stop people dying at the weekend.
Jess Phillips.
No, I understand, but you at least, and Tamal certainly, ought to be standing up for the government, wanting to get rid of this higher chance of you dying at the weekend.
So there's no question there. This is now about people dying at the weekend, and we should be trying to sort that out.
So, all right.
I'm sorry, but what are you basing this higher chance of dying on the weekend?
I mean, the figures are disputed.
Yeah, they are disputed. I mean, that paper, the authors of that paper and the BMA...
That's the 11,000 figure that Mr. Hunt's been using.
Yes, yeah. It's a misinterpretation of that paper, and we've had several papers that have been looked at that have had this same misinterpretation of the statistics. That paper showed that patients admitted Friday to Monday, at 30 days after their stay, had a slightly increased rate of mortality. But the authors of the paper themselves stated that it would be rash to conclude that this was due to staffing. They said it was something that should be looked into, but there were no conclusions made. And there's been no paper that has stated that a lack of junior doctors on weekends is a cause of increased mortality on the weekend. So I think it's fair enough to say that we need to do more research to look into this, but to say that you're basing these contract reforms on a misinterpretation of the paper is just completely wrong.
Well, I thought that's what we were basing the reforms on.
There you have it. Well, I thought that's what we were basing the reforms on. So basically, the reforms that Michael Portillo is supporting is based on something that's plainly wrong. And our junior doctor has just fairly robustly dismantled Michael Portillo's argument without any excitement or anything like that.
But I still don't understand. I still don't understand how, when the government is trying to put patient safety first, you believe you're improving patient safety by going on strike.
But let me ask you
with
this,
your escalation of the
Michael.
strikes for the future.
Okay, so now we're jumping to... It sounds like a bit of a category error, actually. So Michael Portillo is trying to claim that there's some kind of paradox between saying that the argument about the new contract is that it's unsafe for patients, and yet you're putting patients at risk by going on strike.
But let me ask you this question.
But let me tell you what's going to happen.
No, I want to ask you a question.
All right.
So Portillo knows he's on the ropes here. He's trying to filibuster, but Andrew Neil's not giving him an inch.
And it's this. There's a general acceptance that if the NHS could do it, the care should be seamless over 7 days. Many services are now seamless. But I come back to our guest point. I don't see how you can do that, provide the same care on the weekend as you do on the weekend without an increase in resources. Sure, inevitably, it would take more money. He's already having to work hard enough during the week. If he's then spread more thinly over 7 days, it will hit the week. You need more doctors, you need more money.
That's the crux of the issue. So the argument that's constantly trotted out that this was a manifesto pledge and they've got a mandate to do this because they need to offer a 7-day-a-week. But the question arises, well, this doesn't actually address the 7-day-a-week issue because you're not adding any extra capacity into the system unless you're expecting doctors to work extremely long hours, like they did the last time the Tories were in power, ridiculous amount of hours, to try and cover those services, which is really what the doctors' fears are. You're taking the safeguards away, and you want to roll out a 7-day full service. So the only reason, and there's going to be no extra money. They keep saying that the bill's not going to go down, the wage bill's not going to go down, but it's not going to go up either, but yet you're asking for more service to be covered. So basically, you're going to be stretching the doctors thinner. Let's see if there's any rebut to that argument.
But the government has started by offering an 11% rise in basic pay. And then for extra hours each day, the rate goes up to time and a half. On Sundays, the rate goes up.
But the overall
to
pay
time
bill
and a half.
doesn't change.
No.
So notice straight away that Michael Portillo is not talking about capacity at all here. He's just trying to outline why it's such a good contract.
But I think many people watching this programme would say, my God, I wouldn't mind getting time and a half on a Saturday or on a Sunday or for extra hours at the end of the day.
Okay, now we're playing the jealousy card, yeah? People are going to be jealous that you get time and a half. You should be grateful that we're offering you time and a half. Nothing to do with a capacity issue.
I think what's going to happen as a result of this is the junior doctors are going to end up where teachers are today. That is to say, an organisation or a set of people that were once regarded as professionals with very high esteem amongst the public, because they take industrial action, lose that esteem and lose that professionalism.
Okay, so Michael Portillo is really struggling here. He's actually resorted to smearing a whole other profession now, the teachers. It's so obvious that even Jess Phillips has picked up on it. As you can see, she's about to try and make the point, but I don't think she actually gets a chance.
I have every esteem for teachers and the people who are...
Professionals do not go on strike. It's one of the things that defines a professional.
That'd be good. Let Tamal answer that.
I mean, I think
particularly...
No, you got to let him answer the point.
Okay.
Particularly if you've got
Give him
patient
some time.
safety.
He's our guest.
I mean,
Let him speak.
you sort of balk at the idea that this could be about patient safety, but it really is. When we went on strike this week, we were still providing emergency care. There were all sorts of headlines about, this being an issue of patient safety. The emergency care that we're providing is the same emergency care we provide every bank holiday. So no patients came to risk.
But on the third strike, you're not going to. Would you be more nervous about that?
I mean, I think we will still have extra consultants being drafted in to provide that emergency care. So I think even though the junior doctors might be providing a full walkout, there will still be experienced clinicians providing the emergency care that patients need.
Do you think any patient will be at risk?
No, I don't think they will be.
So basically, we've got Tamal Ray actually coming out there and saying, when we go on strike, you're actually going to be safer because you'll have more experienced doctors looking after you. There'll be more experienced doctors in hospital to take care of the emergency situation. So far from being a less safe scenario, if anything, it's slightly more safe, although junior doctors are well supervised during normal times. It's not an unsafe situation to have junior doctors in or in emergency situations, but the fact that you've got a more experienced doctor there actually means that they're not exposing the health service to unnecessary risks.
And I don't think we would be striking.
And you know that
Even
for
with
sure.
the withdrawal of emergency cover, you don't think that? No?
It will be a withdrawal of emergency cover by junior doctors, but
There are many
consultants will be there to cover that
at
service.
risk because of the way that the government is handling things. I have people in my surgery waiting 2.5 years for a mental health assessment for a child who self-harms. That is a problem. And that is something that Jeremy Hunt should be focusing on. So if we're going to be talking about patient care, Jeremy Hunt is the first person we should be taking on, not the hard-working doctors in the hospital.
But wait a minute, we just fought an election on this, and as far as I remember...
I don't think they mentioned a 2.5-year waiting list for kids who are trying to commit suicide.
As far as I remember, your party didn't have any proposals for extra resources for the National Health Service.
So Michael Portillo, is he agreeing there that the NHS needs more resources? He still hasn't explained how this contract is going to have more resources to the NHS unless it's about making junior doctors who already work pretty, bloody hard, making them work even harder.
They did have proposals.
I mean, the current government isn't proposing
None of
any
it was
extra
enough.
resources. It's talking about spreading the existing resources out more thinly across the week. We're already struggling to provide the 5-day service that we do, full service, elective service included during the week. As you've said, we're not going to be able to provide a better service over the weekend if we're spreading that service out more thinly. In terms of patient safety, what we want to do, this is not just about a contract, it's about protecting the NHS for future generations. After us, the reason why the junior doctors have received such unanimous support across the profession, this is nurses, physios, occupational therapists, ODPs, consultants, GPs, all of them are on our side in a way that I've never seen before since I've been a medic, and that hasn't been seen in decades. And the reason for that is that people know that they are next in the firing line. This contract will be rolled out in some form or another for everyone working in the NHS. It will destroy morale for people already working flat out to keep a system afloat. I just think it's going to be a complete disaster. I'd love if we could move forward with the government and actually have some true reform of the NHS, but this is not the way to go about it.
Okay, so there you have it. So actually, I like Michael Portillo. I think he gave a fairly robust defence of the government's position there, and he was systematically dismantled by Tamal Ray there. So yeah, thanks for watching. I think, as you can see, it's quite enlightening, and it's good. And it's good when we see actual ideas put to the test with professionals. So Tamal Ray is obviously a junior doctor who has a lot of experience. He understands the junior doctor strike, and he explained himself very eloquently, as you would expect a junior doctor to do. And I thought this was a good thing for sharing. I'm sure it's been shared millions of times on YouTube, but for prosperity's sake, to just show that actually on the Daily Politics and this week you can have a sensible debate, and this is the finest example of debate on the BBC, and sometimes everything gets a little bit shouty. A lot of people are quite emotional about these issues, and where Tamal Ray, he's quite rightly to be emotional about this. He showed why we respect doctors so much. He was very calm, very collected, and diagnosed the problem and carefully dissected it for us. So I'll try and do a few more of these videos. Obviously time's a factor, but I hope you enjoyed it, and see you next time.